Good afternoon, everyone. Thank you so much for coming to join us today. On behalf of the Macon County Health Department and the Crisis Communications Team, we wanted to call this press conference today because of some alarming things that we are seeing in our community. I know people may see our numbers and think that they've been low, but we're seeing some concerning increases in our numbers and percent of positivity rates, and we are asking the community to come together to address these things. As an update, since Friday, we have had 62 new confirmed cases of COVID-19 in Macon County. We have to also realize that in addition to these confirmed cases, many, if not all of these cases have contacts with whom they have been around, who also now are at risk of spreading COVID-19 around our community and far beyond. Our positivity rate back on June 26th as a county was 3.1%. Over time, with the amazing mitigation measures that were taken, the sheltering in place, and all the sacrifices that you as Macon County residents made, we were able to get that percent of positivity down to 2.4. That number is going up, and it's going up quickly. As of today, the count of total number of tests done in Macon County was 14,083, and our total confirmed cases is 379. That gives us a positivity rate as of today of 2.69%. While that may not sound immediately alarming, the change from just a few days ago in our positivity rate is very alarming to me as a representative of public health, and also to our other community leaders who are joining me here today. I think early on when we talked about COVID-19, there was a lot of discussion about people that were older or that had underlying health conditions. And I think somewhat unfortunately, a lot of people assumed that meant they were immune or that they did not have to take proactive measures. Even in our community here in Macon County, we are seeing an increased number of younger people with diagnosed cases of COVID-19. While many of these particular cases may not be as severe, may be more mild cases, and may not end up resulting in hospitalizations, we have to remember that these are people too. These are people who don't feel well. These are people who may have lifelong effects from their experience with COVID-19. And these are younger people that also are going around people with underlying health conditions, people over the age of 65, and people who could very well have much more severe cases of COVID-19. I've heard the question a lot, where is COVID-19? Is it just in the long-term care facilities? There was so much of that here initially, and again, I think that unfortunately, that gave a lot of people a sense of security. I am here to tell you, without giving out confidential identifying information, that COVID-19 is all over in Macon County. It is not one age group, it is not one facility, it is not one business. It is everywhere, it is in communities, it is throughout Macon County, and we all need to take this more seriously, those of us that are not. Why are there more positive cases? Again, some people are speculating that that's because we're having more tests. Well, maybe part of that reflects that, but when you look at the positivity rate, you see that that is not the only reason. Back when we were talking about going through the Restore Illinois plan, I know that I said a lot of times, the more people move about, our numbers will go up. The more people are around one another, the numbers will go up, and we are seeing that now. So I think that this is something that we all knew could happen and was predicted, and now we are definitely dealing with the reality of that. And as it spreads more, there are people who are scared, and then there are people maybe who don't take it as seriously, and we are asking our entire community to take it seriously. Some of these cases that we are seeing are epidemiologically linked, and some are not, and we've talked a lot about community transmission. So just because you haven't been around someone that you know had COVID-19 does not mean you are exempt from the chance of getting it. Another thing that we were very upfront about, and that Restore Illinois plan was upfront about, is that if our numbers go in the wrong direction, we could very well go backwards in our opening plan and in Restore Illinois. I don't want that to happen, and I don't think our entire community wants that to happen, so we need to come together now as a community and do everything that we can to get these numbers going in the right direction again. We keep on talking about proactive measures at the health department. We can't stress these enough, okay? Those are wear a mask or a cloth face covering, make sure you're social distancing, wash your hands adequately and frequently, stay home if you are sick, and if you are given guidance to quarantine or isolate, please do that to help limit that spread of illness. In phase 4, we all know that you can gather in groups of up to 50. We want to make sure people understand and realize that while that might be allowed, please consider whether or not that's a good idea to do, especially taking into account the population that you are around and the people that you are with. And you should still be following the proactive measures of wearing a face covering and social distancing, even if you are hanging out in those allowable groups of up to 50. We at the health department are continuing to implement contact tracing. As numbers grow, it gets more difficult because a lot of people are moving about and have various contacts. And so we do ask you to do everything you can to limit the number of people that you are around and to take those proactive measures. We also implore businesses, community members, families, to do everything that you can to try to impact these numbers and to try to limit spread, because this can get a lot worse very quickly, and we obviously don't want that. Again, like I said, these are people's lives, whether they have severe complications or not, if they are getting sick, if they're having lifelong issues, if they're missing work and therefore missing income, if this goes through their family, etc., it has a very negative effect. So while it's difficult for me to come out here and tell you don't spend a lot of time with the family outside of your household, don't go to out-of-state, tournaments or whatever that might be for sports where we can't take proactive measures. Don't gather and skip these proactive measures. I know that that's difficult to hear for a lot of people when we've all been cooped up for so long, but these are the types of very responsible decisions we have to make to help save lives in our community and beyond. Early on in this COVID-19 response, I said a lot of times, be a hero, this is your chance by staying home. And now I'm asking you again to be a hero and make the choices to take proactive measures and limit gatherings that you are participating in, and anything else you can do as a business owner, a leader in this community, a representative to whom others look to, as a parent, a grandparent, to help limit this spread of illness. Thank you so much, and I'll pass it over to Julie.
Folks, I think it's pretty clear we need your help. These numbers are obviously going in the wrong direction, and our businesses cannot go backwards. Many are just getting by now. Taking away the ability for restaurants to serve indoors or shutting down our bars and non-essential businesses could very well put them out of business. That's not good for them or us. I am imploring our businesses to require masks, and I'm begging our citizens to wear them. You cannot walk into a store without a shirt. You should not walk in without a mask. The governor was in Quincy this morning telling county health officials in the city they need to shut down and ticket any bar or restaurant that is not following the rules. Now, I do not want us to become the mask patrol, but I'm telling you right now, we've got to get this under control. I don't want to have to go to the liquor commissioner and ask him to start pulling liquor licenses, so let's not go there. But I will be issuing a new emergency order this week that allows us to do just that. The very last thing I want to do is shut down a business that's been through this disaster and is still barely hanging on. We're only 1 month in phase 4, 1 month, and we're seeing the effects of large crowds and people not wearing masks. None of us wants to go backwards. We've got to be in this together to fight this virus and what it is doing to us. And all we've got right now are 3 things, and Brandy mentioned them. Wash your hands, social distance yourself, and wear the masks. And remember, this is not about you. It's about protecting the people around you. Your employees, your coworkers, your customers, your mom, your grandpa, the little kid next door. I am challenging this community, our community, to make August a very different month. Wear your masks, and let's change these numbers. Save our community and our economy. With that, I'll turn it over to County Board Chairman Kevin Greenfield for a couple of words, because he always enjoys that so much.
Thank you, Mayor. As the mayor said and Brandy said, we're going into some pretty tough times here, so it's important that we suck it up and wear the mask. I know there's a pain, and I'm probably one of the worst ones not wearing one, but I can tell you I'm gonna do better. Back in the middle of April, I got a phone call from Springfield, from IEMA. And at that point in time, they suggested Macon County have 4 refrigerated trailers on hand. Now, I can tell you, that scared the hell out of me. Still does. So the last thing I wanna do is be standing beside a refrigerated trailer when somebody's body from Macon County goes in that trailer. And yes, that can happen. So I'm asking you, please be courteous to other people and wear the damn mask.
Tanya Hendricks is also here from Crossing, if anybody has any questions for her. We didn't ask her to make any kind of formal presentation, but we're all available. So if there are any questions, we're here to answer them.
Mayor, I do have a question. Can you, again, you're implementing an emergency order should you need it. Can you just go over that one more time?
Yes, in order to order an establishment to shut down because they're not complying with what we feel is a public health threat, and that is a bar full of people or a restaurant full of people with nobody wearing masks and not taking this seriously, then we can yank their liquor license. I don't wanna do that. But the executive order will allow us the authority to do that if we have to. And that's a road we don't wanna go down. But we are at the point where people are not taking this seriously. We have to do something. And I'd rather this be Macon County people making these decisions and taking care of this. I don't want the state or anybody else coming in and ordering us to do this. We're good at things all by ourselves. We can take care of this. We just have to be responsible. And that order would stay in effect until the next council meeting, which is 2 weeks away. And then at that time, the council would make a decision as to whether to keep it in effect.
Do they have to vote on that now, though?
No, they do not for an emergency order such as this.
Mayor, prior to an emergency order, what kind of punitive measures already exist or are there any measures?
Well, we don't have penalties in effect for not wearing a mask. Some communities have enacted ordinances, some have very high fines. Early on, we looked at that and whether to do it, had a lot of public outrage, and we backed away from it. We pulled it from the agenda. We did not take any kind of action. It's possible that we may look at that again. You know, I have not talked to council about that. These numbers spiked over the weekend. We were watching them and being concerned last week as, you know, instead of seeing 4 or 5 new cases a day, it was 8, and then it was 13, and then it was jumping up, and we could see the other counties around us doing the same thing. So, currently what we do is we warn them, you know, in kind of a friendly reminder, because as for example, our restaurants and bars that have tables outside on public property that don't, you know, currently have their own patio, this was a gift to them from the city that, yes, do this, do whatever you can to get yourself back in business. But one of the conditions was that they were gonna follow the guidelines. And so if they're not following the guidelines, we can take away that ability, which we don't wanna do that either. We want our businesses to survive this, to prosper, to get back on their feet. And restaurants and bars, those are really, really hard businesses. Small business is a hard business. So anything we can do to help them, but they've gotta do their part too. And I've gotta ask people, you know, the 19-year-old clerk that is, you know, at the gas station or Target or wherever that's checking you out, this is not his or her job. You know, they're doing what their management is telling them to do. The sign says wear a mask, wear a mask. Everybody needs to do it. It's not that hard. Other questions, or we can let you do your own thing?
I had a question for Randy.
Randy?
Yes.
So we've talked about how we're trending upward. In terms of the various metrics that determine whether a region or a county can become a warning area or versus whether we can go back a phase, I guess it gives a picture of how close we would be to something like that happening.
So I know this happens as a region, not specifically as a county, and as of, so Region 6, as of July 23rd, we had a 9-day positivity rate increase, a 3-day hospitalization increase, and a 2.8 positivity rate. And in order to move back to phase 3, and this is online as well if you need to pull it, but we would have to have a 7-day positivity increase, and as I mentioned, we've 9 as a region. 7-day hospitalization admission increase, and that's at 3. Or an 8% positivity rate, and the region is at 2.8. So that kind of gives you an idea, and just for everybody's reference, the county-specific metrics and region-specific metrics are all on the IDPH website. They are a little bit dated though, because they do it on a 7-day week. So the current metrics are July 12th through July 18th, and we've seen a lot of change since July 18th here locally. So I expect that to be negatively affected once those metrics are updated as well. We're trying to watch things closely locally so that we are on top of it. Even the positivity rate on the IDPH website for Macon County specifically is not as current as what we shared with you today. Those were numbers directly from IDPH this morning.
And the healthcare industry here is getting somewhat overwhelmed. Tanya, if you want to mention a little bit about what you're seeing on the front lines, I think that would be helpful to put it in perspective too.
Good afternoon. I think it's important for everybody to understand that Crossing Healthcare is one testing site in Macon County. We're an IDPH contracted site. We're getting inundated with calls for testing. We test 6 hours per day, 6 days a week, and we are currently doing our very best to prioritize testing for those who are exposed. However, I have to tell you that we're testing the same day the next day. Our goal is to make sure that everyone who needs a test obtains a test, but you read stories about challenges for people obtaining testing throughout our country, and our goal is to make sure that that doesn't happen locally. However, I have to tell you, the numbers and the increase in requests for testing has been significant, and I'm concerned about our ability locally to make sure that we can meet that demand. And so I again implore everyone in the community to be sure they're following the guidelines. Make sure you're wearing a mask, you're social distancing, and washing your hands. It's simple. It's all things that we can do, but it's what we have to do to protect our community and to protect the businesses and our economy. Thank you.
Julie, I do have a question.
Sure.
You keep talking about the bars and the restaurants, and obviously you can't eat and drink with your mask on. So what are the guidelines to obey the rules while still, being able to eat your food?
And Brandy, correct me if I get off on all of these. The tables need to be distanced apart. I believe Chicago has 6 people at a table, and we are allowed up to 10, I believe, by the guidelines. Servers need to wear masks. If you get up and leave the table, go to the restroom or something, you have to have a mask on. If you're stepping outside for any reason, you have to wear a mask from your table. You can have them off at your table right now.
Okay, I just want to make sure we made that clear.
You're okay, but it depends on the establishment you're in. Some are really good and people are really following it, others are not. And there's the whole wearing the mask correctly too. If it's down under your nose, that's not the correct way to wear it, and it's not protecting anybody. So it's wear the mask and wear it well. I think Kevin's having shirts made. Wear the damn mask. Any other questions? Thank you all, appreciate it.